You are listening to Category Management Musings from the Empower Group, and I'm Ann Kohler. First, we hope that you and your family are staying healthy and safe. Second, as we are all dealing with internet connections and working remotely, we apologize ahead of time if there are any audio-related issues with this podcast. This is a special edition of our podcast focusing solely on the impacts of COVID-19. We promise to get back to discussing category management and specifically the domains within our category management maturity model, but we felt like this topic was not only timely, but also absolutely critical for those of us in supply chain. It was literally less than 30 days ago that most of us were going along our daily business uninterrupted. Then, bam, the entire world changed in an instant, or so it seemed. Today, we are hearing that there are few new cases in China, supposedly. Wuhan is getting back to normal and factories are reopening. Singapore is also getting back to normal and South Korea is on its way. Europe continues to be in crisis, as does the U.S. At the end of the day, all such catastrophes are fundamentally supply chain challenges now and post-event. It's the disruption or lack of surge capacity that is a major barrier to recovery, including from COVID-19. There have been many short-term impacts, and some of them will be long-term as well. Let me start by mentioning that the short-term and long-term quantifiable impacts are only the tip of the iceberg. The much more important impacts are the non-quantifiable ones because they impact long-term decisions and behaviors far, far more than the quantifiable ones. I know this sounds so totally counterintuitive to people in our function, and especially for someone like me who was a CFO before I was a CPO and then a consultant. But one thing I have learned is that metrics drive decisions and behaviors. And if we get caught up in an incomplete set of metrics, we may totally miss the rest of the iceberg at our own peril. So here are some of the quantifiable impacts, both short-term and long-term. First and foremost, our supply chains have been disrupted, and short-term, there has been a shift away from China. Long-term, we should expect to see more onshore versus offshore sourcing and more insourcing. Our financial markets are in turmoil. That may be relatively short-term, but who knows? Travel in the short term is more selective, and there will be less personal travel. Long term, we may see less professional travel, more remote work, and technical solutions to replace professional travel, even for things like supplier relationship management. Remote work. Short term, everyone is doing it where we can. Long term, we may see a permanent increase because remote work may be more acceptable. And as a result, talent management may be quite different because it will allow us to bring in talent where we are more accepting of that remote work. Ramping up of supply chains quickly in the short term, where we are ramping up supply chains for sanitizers, masks, and ventilators, and a pivot for companies that can make those products in the short term. We'll see what the long-term supply chain impacts are within the next few months. Price gouging, hopefully that's short term. Expansion of healthcare capacity in the short term, but long term, we may see a fundamental change in healthcare practices, things like telemedicine, and perhaps even eventually Medicare for all. In the short term, we've seen alternative care for the elderly. We've seen people actually taking some of their families out of nursing homes for protective health reasons. Remote school. In the short term, we've seen schools go virtual where they had no virtual capability. This may be a long-term change, particularly in higher education, where they were forced to make the change and now see the advantages of doing so. In the short term, we've seen an increase in internet capacity or lack thereof. In the long term, we may see a permanent surge or major spending in this area, both personally and professionally. Personal services. So in the short term, we've seen a shutdown in things like barbershops, nails, salons, etc. And even though we were slow to do that, in the long term, they will eventually come back, but probably as slowly as we saw them being shut down. In the short term, we also saw alternative forms of entertainment. So where we could go to a concert today, we are seeing concerts on the web, and that may be a long-term change as well. In the short term, we've seen cancellation of major events like weddings and graduations, but this may also be a long-term change because it's going to take a while for those such events to come back. In the short term, we've seen feeding of the poor, so children's lunches at schools where we've been providing those regardless of the fact that schools have not been in session. Protection for our first responders and medical workers. That's been a short-term change, but my guess is long-term, PPE will continue to be a need probably for the next few years until we make some permanent changes. And then private sectors finding solutions to problems. So we've literally seen new industries forming around PPE, for home, for car protection, for new insurance products. While that's been a short-term fix, we'll probably see some longer-term solutions in that arena as well. But now let's move into the much more dangerous impacts. And those are the ones that are below the tip of the iceberg because they are not measurable, maybe not so quantifiable in the classic sense. The example I often use is when my husband went out to buy me a new used car, and my most important criteria, or my stakeholder value driver as we call it, was that it had to be white. He kept presenting me with a number of options, but the only one I would consider was one that was white. How do you quantify my desire for a white car? You can't, but it was nevertheless very important to me. So I considered that to be an unquantifiable value driver or criteria. So here are the unquantifiable impacts, both short-term and long-term. So one is anxiety, fear, and stress, which is what we are all feeling today. Can't necessarily quantify it, but we expect that this is not only short-term, but will be a long-term impact as well. Financial prudence. So as all of us, may be looking at lesser paychecks or no paychecks, we're actually sitting around and thinking about how we would change our behavior long-term in terms of financial prudence. And that also ties into less risky behavior. We may be less likely to behave in a risky way going forward because we're thinking about the long-term impacts of some of our behaviors. Another long-term unquantifiable impact may be distrust of government. So lack of credibility or delays in actions has maybe made us take a pause and think about the type of government that we have in place and what we want for the future. Another long-term impact is that of social distancing everywhere. We are all feeling it short-term, but don't be surprised if social distancing continues long-term or at a minimum comes back where we can all get together very, very slowly. A sole focus on COVID-19 while other things are happening. I know when I turn on the news, the only thing that I'm hearing about is the coronavirus, and anything else that's being discussed is sort of taking a back seat to what we are all experiencing right now. Another long-term unquantifiable impact may be missed professional and educational opportunities. So, canceling of sports, no clinicals for nurses. I'm thinking of those kids that are graduating in the next couple months. If they had job offers, will they still be there? Will they be able to find jobs? So that is also an unquantifiable, both short-term and long-term impacts. Impact on elections. I know we had our election in Illinois a few weeks ago, and we had a very, very low turnout, and Wisconsin experienced the same thing earlier this week. And then more collaborative behaviors, neighbors helping neighbors, internal collaboration with our business partners, collaboration with our suppliers. And while that may be a short-term impact, I also hope that that's a long-term impact in the long run. I have one client that I just talked to who has, talked about some of, the things they are doing with their suppliers to try to help them out in the short term. But what that is doing is that is creating long-term goodwill that hopefully will multiply as we go forward. There perhaps has not been an event like this virus in a while, and yet some consider this to be a black swan event and others do not. If this is not a black swan event, then this has been a spectacular risk management failure for the world. And there is a strong argument to be made that the only difference between this and other very similar and recent viruses, such as SARS, MERS, H1N1, Ebola, etc., is that this is a different strain. By thinking of this as a black swan event, one would have to argue that we need a different response mechanism for each virus, which is illogical and insane, which means that this was a predictable and inevitable event. Our theory is that if an event is predictable, and one could say, and we've heard on the news, Bill Gates predicted this years ago, and it is inevitable, and inevitable means we know it will happen, then we should be developing a solution even before it happens, or we will pay a humongous price for waiting till later to deal with it. Those countries that moved with speed, even though they waited until after the event had occurred, are reaping the benefits of it, and hopefully they will have a permanent solution in place. As an example, China was able to stand up fully functioning mobile hospitals in 7 days and stood up a hospital staffed by robots to minimize human interaction. South Korea had drive-through testing for the same purpose in just a number of days. And even on the social distancing front, China and Singapore were able to use much more discipline and therefore bent the curve quite quickly. Now, let me connect this last point around the unquantifiable impacts that we just talked about. At a personal level, we all need to acknowledge that we are in for a totally different lifestyle going forward, and we have to figure out how to adapt to it very quickly. Here are just a few examples from Dr. Fauci earlier this week. He talked about no more handshaking, maybe ever. Compulsive hand washing multiple times a day, maybe forever. Diminished crowd sizes for a very, very long time, and maybe even masks as a part of our daily life outside. And the story is similar on the supply chain side. We are experiencing critical shortages of PPE, bed capacity in hospitals, and even the supply chain of medical personnel as they fall sick. And the multiplier effect of all of that is incalculable. In addition, as the world continues to be shuttered for weeks, maybe months on end, the supply chain issues across every industry will be enormous. As such, there has never been a more critical time for our function, both in terms of the challenge it represents, but also the opportunity it presents, and we need to be ready to accept those challenges. Please continue to join our podcast as we explore how we can make a difference within our organizations and be a competitive advantage for our company. I thank you for joining us today. Our next podcast will cover the next domain in our category management maturity model, risk management. As we work through this virus together, please keep you and your family healthy and safe.